I'm on chapter 8, Healing the Child Within. On to stages of recovery for the child within. Survival. To get to the point of recovery, we must survive. Survivors are to be necessity codependent. We use many coping skills and ego defenses to do this. Children of alcoholics and from other troubled or dysfunctional families survive by dodging, hiding, negotiating, taking care of others, pretending, denying, and learning, and adapting to stay alive using any method that works. They learn other, often unhealthy ego defense mechanisms as described by Anna Freud and summarized by Vallon in 1977. These include intellectualization, repression, dissociation, displacement, and reaction formation, all of which, if overused, can be considered to be neurotic, and projection, passive-aggressive behavior, acting out, hypochondriacs, grandiosity, and denial, all of which is overused, can be considered immature and at times psychotic. While these defenses are functioning and surviving other dysfunctional family, they tend to work poorly for us adults. When we attempt to participate in a healthy relationship, they tend not to further our best interests. Using these stifles and stunts our child within and promotes and reinforces our false codependent self. Jenny was a 21-year-old woman who grew up in an alcoholic family. At the beginning of her recovery, she wrote the following poem. It exemplifies some of the pain of survival stage. Afraid of the Night, it's called, the poem. Like the child waiting in the night for warm hands and arms to wrap themselves around her loneliness, to spend herself in tears of sudden safety and of love. I too, in the darkness, aloneness of self unloved, unanchored, abandoned, and denied, still summon with silent child cries, an ancient hope, the old sure magic of wantedness. The child still lives in me with the eager hurt of innocence, bewildered and betrayed. Ah, that painful paradox. To sense the rescue and know there is none, but driven by old dreams, pale yet powerful, remembrances of the soft, dear touch of love, I wait. One waits, one always waits. It is forgotten, that nameless need. The years have beaten from my wasted heart, but like some unshaped primal force, it beckons, crowds my reality, blunts stiff reason. And I am grotesque with helpless wanting, turning my mind inwards, backwards. Dull too is the pain with young memories that weaken and defy, submit then die. I do not live, I wait in such unhope. Here Jenny tells us about her pain, numbness, isolation, and hopelessness. Yet she also reflects one ray of potential hope in the line, the child still lives in me. Part of her recovery is to discover ourselves, our child, and how we use these ineffective means of relating to ourselves, to others, and to the universe. This can be most productively accomplished during the working stages of recovery. While it is clear that we are surviving, it is also true that we experience a good deal of pain and suffering, or we become numb, or we alternate between pain and numbness. Slowly we become aware that these very skills and defenses that allowed us to survive as mistreated infants, children, and adolescents do not work well when we try to have healthy, intimate relationships as adults. It is the painful effects of the abuse and neglect and this failure in our relationships that do not work for us, that push at times even force us to begin looking elsewhere than these ineffective methods. That looking elsewhere can trigger our recovery. Gravitz and Bowden, 1985, describe recovery in their adult children of alcoholic patients as occurring in 6 stages. 1, survival. 2, emergent awareness. 3, core issues. 4, transformations. 5, integration. And 6, spirituality. These stages, Genesis of spirituality. These stages parallel the 4 stages of life growth and transformation described by Ferguson, 1980, and 3 stages of the classical mythological hero or heroine's journey as described by Campbell, 1946, and by myself and others. We can clarify and summarize the similarities of each approach as follows. So it's just a chart. Each stage is useful in healing the child within. Each stage is often recognized only in retrospect. When we are in this stage, we do not always realize that we are there. There is only one reason why it is helpful to have a sponsor, guide, counselor, or therapist during recovery. A therapy group that uses principles of adult children of alcoholic recovery described in this book or elsewhere can be especially helpful. Awakening. Awakening is the first glimpse that things or reality are not what we thought. Awakening is an ongoing process throughout recovery. To begin, we generally require an entry point or trigger, anything that shakes up our old understanding or belief system of reality, or of the way that we thought things were. Because our true self is so hidden and because our false self is so prominent, awakening may not come easily. Nonetheless, it often happens. I have witnessed this process in hundreds of children of trauma. The entry point or trigger may range across a wide spectrum. It may start with hearing or reading someone describe their own recovery or own true self, or being sick and tired of our suffering, or beginning to work seriously on another life problem in counseling or therapy. For others, it may be attending a self-help meeting or an educational experience, reading a book, or hearing about it from a friend. At this time, we begin often to experience confusion, fear, enthusiasm, excitement, sadness, numbness, and anger. These means that we are beginning to feel again. We begin to get in touch with who we really are, our child within, our real self. At this point, some people will give up and go no further. They find it easier and more comfortable to retreat back in their false self. Those who are recovering alcoholic, other drug dependent, or dependent upon other unproductive behavior such as overeating or compulsive gambling and the like may begin to experience a relapse, or they may precipitate another form of shame-based compulsive behavior such as spending money that they do not have. But this awakening can be an opportunity to take risk or plunge to discover our whole self, our aliveness, and eventually some lasting peace. Finding help. At this point, it's helpful to find a sponsor, counselor, or therapist to help discover and heal our child within. The recovery person, however, is usually so vulnerable, often related to confusion, fear, and enthusiasm, and/or resistance to recovery, that they may find a sponsor or clinician who has not worked through their own recovery of their own child within. If that person cannot get their own needs met, they may use the newly awakened person to meet some of their needs. That result is the patient, client, student, or a pigeon is traumatized again, resulting in a vicious cycle of unresolved trauma and return to the false self. Guidelines. The following guidelines to find a sponsor, therapist, or counselor who will usually tend to be helpful rather than harmful. Demonstrate training and experience. For example, a clinician or therapist has training and experience in helping people to grow mentally, emotionally, and spiritually, as well as being effective in helping with some problems or conditions. 2, not dogmatic, rigid, or judgmental. 3, no promises of quick fixes or answers. 4, while you sense they are genuinely respect you as a human being in your recovery growth, they are firm enough to push you to do your own work of recovery. 5, provide some of your needs, listening, mirroring, echoing, safety, respect, understanding, and accepting your feelings during therapy session. 6, encourage and help you to learn to find ways outside therapy session to get your needs met in a healthy way. 7, they are well progressed in healing their own child within. 8, they do not use you to get their own needs met. 9, you feel safe and relatively comfortable with them.
Wait.
Occasionally, a friend during recovery has many of these qualities. However, a friend or a relative is not forced to listen with full attention and is generally not trained in helping you work through your specific problems or issues. Friends and relatives may want you for their needs, sometimes in unhealthy and unconstructive ways, and some friends or relatives, usually unconsciously, may sooner or later betray you or reject you. You may end up feeling toxic or crazy. Being close to these unrecovered people is generally not safe. Avoid them when possible. It will probably take some time before you can trust the process of therapy and recovery enough so that you feel okay about taking risks to being exposing your true self. Give yourself that time. For some, the needed will be relatively short, a matter of weeks. For others, it may take longer than a year. It is important to share these fears with your therapist and not withhold them. Taking these one-step breaks patterns of denying feelings you learned as a child. As you feel a sense of trust, you may begin to risk talking about your innermost secrets, fears, and concerns. I have described the healing power of telling our story in Chapter 12, and in alcoholism and spirituality, and others have also described it. When in individual or group therapy, it is helpful to talk even if at first you may stutter or ramble. Feel free to ask your counselor, therapist, group leader, or a group member for feedback about how you come across. No matter what type of therapy you choose, it is helpful you do much of the work of recovery on your own outside the session. Eventually, when you first talk to others about yourself, it is useful to your recovery that you begin to become clearer and briefer, especially if you are in therapy group or self-help group. There is a truism in counseling that people in therapy generally relate and behave in the same or similar ways they behave outside of therapy. It may be helpful in your recovery to ask your therapist or group how you are doing in this area. Finally, there is an issue of transference in therapy, which includes your feelings and conflicts around your relationship with your counselor. Take risk and express exactly how you feel, even if angry, shameful, guilty, or whatever, no matter how unimportant it may seem at first to you. Your feelings are okay, despite your fears. They are bad or unjustified. Once you feel trusted enough so you can risk self-disclosure in your recovery, you are usually ready to begin conscious work on some of your core issues, which I address in the next chapter. So Chapter 9, beginning to deal with core issues. So there's all or nothing thinking, control. I have to start dealing with the core issues. Being over responsible, neglecting our needs, high tolerance for inappropriate behavior, fear of abandonment, difficulty handling and resolving conflict, beginning to talk about our issues, triggering core issues. Then the next chapter, identifying and experiencing our feelings. Okay. See you in my next video. Hope you enjoyed.